We were working on a COVID-19 vaccine.
It's not approved yet. Only halfway through its first clinical trial, it's not even on the government's list of leading vaccine candidates. Still, Manitoba's premier is betting on it.
This is insurance, and it's important to have insurance, especially
Brian Pallister, openly frustrated with the pace of federal vaccine rollout, committing to buy 2 million doses of an unproven Canadian vaccine.
I want Manitobans to get vaccines, and I'd rather they got them sooner rather than later.
Calgary's Providence Therapeutics is hoping to have its mRNA vaccine approved by fall. This deal gives it cash to start producing and stockpiling doses this summer while it waits.
It's at risk. Manitoba's taken some risk, and we've taken some risk so that we can start the process earlier.
Even then, most Canadians may be vaccinated before it's approved. This was the Prime Minister earlier this week.
We are still very much on track for tens of millions of doses into the spring, and for everyone who wants to be vaccinated by September.
It's likely that we're going to have to vaccinate people every year, depending on the variants.
This expert says building domestic production is critical. Providence holds similar promise to Moderna and Pfizer.
It's essentially the same vaccine. We're talking Coke versus Pepsi.
Providence, which says it can pre-produce 50 million doses, is openly courting the provinces.
It's not off the table for Saskatchewan as well.
We need to do our homework, make sure it's technically feasible.
Look, if the feds deliver all the vaccines that they say they're going to deliver, then this is important for future pandemic responses.
The real risk here is in those vaccine trials. If it's not approved, Manitoba loses its deposit. If it is approved, Manitoba is first in line for what could be Canada's first homegrown COVID vaccine. Cameron McIntosh, CBC News, Winnipeg.